inviting the views. Our next speaker, Dr Murti, the founder of in London, claimed for the integration of Ayurveda and functional medicine. His tailored approach to healthcare, utilizing evidence-based techniques, caters to the individual needs of each patient, resulting in consistently remarkable health transformations. His practice is held in high regard by prominent figures in the UK. There's a lot more I can say, but because of the time, I can ask Dr. Murti to please address the gallery there for 4 minutes, please. Thank you. I'm scared of it, that's why I said 4 minutes.
Namaste and good evening to everybody, Excellency, relationship, and Mr. Bob, and the distinguished gathering here, and also those who are watching Zoom. I'm deeply mesmerized by the degree of interest that their professionals. What I'd like to say is as a brief about Ayurveda, crossing over consciousness, medical science to be very useful at an individual level as a personalized care. I would say what has really been astonishing is really first showing the rise of popularity of Ayurveda globally. In a recent report from the Confederation for Communal Industry and also PricewaterhouseCoopers report, it showed that in 2015, the global market for Ayurveda was around 2.85 billion pounds, which has tripled in 2022. That's a big jump from 2.85 to nearly 10 billion pounds. And I also must share that in terms of popularity of Ayurveda, just last week, there's been a lot of classical Ayurvedic range of skincare at Harrods. So it speaks for how Ayurveda is so popular amongst the general public. I'm a full-time clinician and researcher, so I regularly contribute to research papers on public health perspectives of Ayurveda and also clinical research. But what I believe, what we probably need is really to translate this ancient timeless wisdom of Ayurveda into something that most of us can understand easily without having to learn a new language. As most of us who have been trained in India as Ayurvedic doctors, we studied Sanskrit for several years. For me, it was a passion since my childhood, which is what took me to Ayurveda, the Sanskrit. And I was thinking, for this gathering, as Majid Bamraji had asked me, can you say something which everybody can use from Ayurveda? Obviously, everything that anybody can use in terms of personalized health has all been said in the past. Thanks to ChatGPT now that we actually can simplify our own translations of Sanskrit into English. And I was looking at a particular chapter in Charaka Samhita and also in other classics, where it talks about 210 best practices for health. And also, some of them are really the most efficacious practices of those times. And those who are Ayurvedic physicians here will know that there's a chapter called Agriya Sangrahaniya. Agriya are the foremost, the top, and Sangrahaniya collection of that. And I was looking at, is there anything that we can look at from nutrition perspective? Because as a functional medicine doctor, a great emphasis is really about reversing causes of risk factors by looking at modifiable lifestyle practice. Also, as a public health researcher, that's where our focus is. But when we look at aggressor and I was about to actually read out and translate the 8 wholesome practices and 9 unwholesome practices, which are called hitakari and ahitakari, that are mentioned in Agrasanrani. I thought, for my patients, who most of them really don't understand Sanskrit, I was thinking, if I'm to put that into one sentence, what can we say from Agrasanrani? So I'm going to read it out. So it could be as simple as eat well and likely to improve your health. Change your diet with the seasons. Enjoy a variety of natural foods. Avoid eating the same things all the time. Eat to relieve stress, not to add to it. A balanced diet is key to good health. I must say, if we took each one aspect of this and looked at the amount of public health research that's there, then we can just imagine the wisdom, the depth of inquiry which has been there in Ayurveda in ancient India. The only disappointment for me is we actually, despite the uninterrupted tradition of Ayurvedic practice, we haven't really equaled our inquiry and dissemination of health wisdom the way how ancient Ayurvedic classics have done. So I do encourage all of you to really take deep interest in Ayurvedic classics and then to translate that into what is most relevant for any of us today. We definitely need advocacy for Ayurveda, and I must thank Amarji Kamraji for doing this fantastic job of bringing all of these different people who are working to use Ayurveda for the therapy society together by giving an opportunity in a platform like this for us to again recommit ourselves to the power of Ayurveda. Thank you.
Thank you, Dr. Murti. And I hope